Welcome to another edition of Disability and You. I'm Ganesh Singh and I'll be with you for approximately 30 minutes. On this edition, I will be discussing autism, and to discuss that topic with me is Dr. Kian Chung, who is the Assistant Chief Education Officer with responsibility for special education needs, Ministry of Education. He is also an autism specialist and a commissioner at the National Commission on Disability. So our focus will be on autism, diagnosis, intervention, and what are some of the structures that needs to be in place to ensure that we can create a more inclusive environment for children with autism. Dr. Chung, welcome to Disability and You.
Thank you. Thank you for having me again.
All right, we're not going to focus on what is autism and so forth. I'm sure members of the public are quite aware of that. But do explain to us what is available for children with autism currently.
Great. Excellent question. I again thank you for having me, because I think it is with initiatives such as this, the word gets out as to what has happened, what has changed over time.
Definitely.
And it gives parents a better idea as to what can happen for them. So what we have right now from the Ministry of Education standpoint is that there's a screening instrument that is out there. So teachers with children in schools can screen their children. I know the nursery year 2 teachers in regions 2, 3, 4, 5, 6, 7, 10, and 9 have been trained to use the screening package. So if you've got a kiddo in nursery year 2 or in nursery year 1, know that its teacher there is trained to use the screening packet and ask them about the screening packet there. Mm-hmm. So there's the screening packet, and then the screening packet comes with an intervention aspect. The intervention aspect of it can be a twofold intervention. Some of the cases for kids on the spectrum may require an intervention from health-related perspective, and so they can have that. But it's all culminated in this screening packet where we document it. So it's being co-managed by health and education, which really is phenomenal as it aligns with best practices. Yeah, that's awesome if it gets going that way. Mm-hmm. And that leads to screening more along the lines of autism, and the Ministry of Education uses a number of checkpoints or reference points as it relates to that. Mm-hmm. What I should say before you go, sorry, is that we at Education are not likely to give a diagnosis of autism before the age of 6. Mm-hmm. Because there can be a number of other factors there. Sorry, I'll let you go.
Precisely, and that's exactly the question I was going to ask. So when the nursery school teachers do this screening with children that they might encounter that exhibit certain behavioral patterns that are not in sync with so-called normal behavior, when they conduct that screening, do they then refer to the specialist for further diagnosis if required, or do they start with the intervention? Because you mentioned screening and intervention at the nursery school level.
They start the intervention because we need to understand the cultural factors that play into it. The little kiddo not sitting, the little kiddo with behavioral issues, it could be something that an antecedent, so to speak, an antecedent behavior. The child comes with that from home because it's how he or she's allowed to be at home. So they come into the classroom like that. So for that teacher, when doing the screening, they'll understand, or they will document that little Ganesh isn't sitting. Little Ganesh gives no eye contact, and so they work on activities to foster sitting and eye contact with little Ganesh. Mm-hmm. The officer, at tier 2 level intervention, the officer would come in if that intervention they worked up. Again, offer some more intervention. Mm-hmm. Failing to do that, well, then they can be referred to the diagnostic center.
And that's where the specialists, they would get involved.
Yes.
To provide that diagnosis. And I'm assuming that's the reason why you guys wait until 6.
Yes, we wait until 6. But before 6, what you can have is a family intervention service plan, whereby we're going to use, let's say, the ASQ, Ages and Stages questionnaire, in addition to perhaps the MCHAT. And we can say, based on what we see here, there is a probability that Ganesh is on the autism spectrum. Mm-hmm. There is a probability. Based on that and based on the areas of weaknesses, we'll identify goals that Ganesh's parents can use with him. So you use these periods over a period of time, and then we come back and we reevaluate Ganesh to see if he's made any improvement. Mm-hmm. But all of this is data information being gathered. So when it comes to the time and we've reached the age of 6, it is not just giving Ganesh an autism diagnosis based on just the use of this one instrument, but it would have been a pattern and a history also complementing that. So it's validated.
All right. And I know that the ministry has control over the public schools. However, they can give guidance to private facilities or private institutions.
Absolutely.
The screening packages, are those available in private schools?
They are going to be available in private schools, yes.
And the reason I'm asking is that we have a lot of, and autism seems to be the sexy subject these days
Yes.
within the disability community. And everyone is popping up and claiming to be an expert. You have a lot of facilities mushrooming, providing diagnosis, intervention, and so on for children with autism. I've interacted with many parents, and their experiences are not great, and they have a lot of questions, even though their children might be part of these facilities or attending these facilities. How do we not necessarily control that, but how do we deal with this trend?
Well, we can't necessarily tell the people to close their doors. But what we
Precisely.
can say to parents is that you cannot get a diagnosis, or no one should give your child a diagnosis based solely on a one-time screening and a one-time filling out of a document. There needs to be a pattern before you arrive at this autism diagnosis. Secondly, when we talk about the criteria for meeting the eligibility for an autism diagnosis, we're talking about deficits in social interaction and communication, and you must have deficits in all of the areas. We can go through the areas at another forum, or we can, maybe something the Ministry of Education needs to make public. Restricted and repetitive behaviors, you should have at least 2 of those behaviors being present either currently or in the past. There should be symptoms of other behaviors in terms of socialization skills. But most importantly, and criteria E for the list of the criteria for having an autism diagnosis says that the manifestations that you see should not be otherwise explained. Means that if I'm seeing this kiddo, the kiddo has problems with cognition, the kiddo has problems with daily living skills, the kiddo has behavioral issues, not looking at you, not paying attention to you. In that synopsis that I just gave to you is also an intellectual disability. So then we ask ourselves, is it an intellectual disability or is it autism? And I think this is where most people get confused and carried away, in that autism is being, or intellectual disability rather, is being masked as autism. And something that parents need to be mindful, because when you go to a school, you place the child in a setting for autism. But while the child may have autism, they have autism and a cognitive delay. Cognitive delay is the one that you really want to work on if you're thinking about an academic thing, which is what we do in education. So placing the child in a setting that allows for them to grow is what would be important. So the intellectually impaired department would be the most instructive department, as opposed to the autism classroom. But like you rightfully said, autism is romanticized, and people would more likely receive a diagnosis of autism as opposed to a diagnosis of intellectual disability.
Yeah, and sometimes because parents, they're just looking for some level of certainty, they're looking for answers, and with these specialists that give them a one-time diagnosis.
But let me just interject
Go
here,
ahead.
sorry. At the diagnostic center, if you come from any one of these places with a diagnosis, we do not change diagnosis.
Why?
Because it can be confrontational. Because, like I said, some people, particularly those who come with a diagnosis of autism, they are happy that they have got the diagnosis of autism, even though it's not autism in some cases. So what we do is we look for the present level of academic performance. Okay, you already have autism diagnosis. How is this child functioning? What age level is this child functioning at is what we look for. And this is not just in Guyana, it's a standard practice anywhere in the world. People who have left Guyana with a diagnosis from Guyana, from the diagnostic center, they take it overseas, they do not do a diagnosis for them. They reevaluate them, not necessarily for diagnosis purposes, but to see what level they're functioning at based on the diagnosis that would have been given.
So you're telling me that if someone misdiagnoses a child, and that diagnosis will be with them for the rest of their lives?
Absolutely. That's why parents must be mindful of who gives the diagnosis, and they must go back to what I just said, that you cannot, no one should give you a diagnosis based solely on a one-time visit. No one can give you a diagnosis solely based on this one instrument that they have used to guide you.
But who is qualified to conduct an assessment or a diagnosis for
Where? In
autism?
Guyana or in the world?
No, in Guyana. Or what are the, well, let's say in the world, what are the minimum standards? Let's look at that because,
It'll vary. It'll vary. Because the health sector, I guess you looking at a pediatrician who's had a history of working with children and diagnosing autism would very well fit the mandate, or the bill rather. A clinical psychologist, again, who's trained in autism and autism diagnosis, again taking into consideration the
and
different,
preferably someone with their PhD
yeah,
and not a master.
and an educational diagnostician such as myself.
So persons must possess either of these.
Yeah, yes, absolutely. Because you've got to know what it is you're looking for, because not everyone who displays not looking at you, not paying attention, hyperactive behavior, flapping their hands, those are behaviors that are also aligned with someone with a profound intellectual disability.
This is very interesting, Dr. Chung, because how do we curb this practice of misdiagnosis? And what role do you think the Ministry of Education and the National Commission on Disability, being the focal point for disability in Guyana, have in this process?
I can assure you and the public that the Ministry of Education has everything in place to safeguard ourselves.
Yes, but
In
what
the
about the
reporting
children out there?
process at the Ministry of Education, it goes through a chain before the report is actually issued to parents. Every report goes through a chain, it's checked, it's questioned. We have what we call an elaboration. At elaboration discussions, the different specialists provide their views, and we go back and forth. How did you arrive at this? What did you take into consideration? What instruments did you use? How were the instruments used? Under what conditions they were used? All of that before we arrive at a diagnosis.
But how do we get this to be the national standards, Dr. Chung? That is the question that needs to be answered, because we will continue to have children that are being misdiagnosed, and that label is stuck with them for the rest of their lives, might not get the accurate intervention that affects their independence as an adult, and it messes their whole development.
Well, I think from the Commission of the National, from the position, sorry, of the Commission of the National Disability, from the position of the Commission on National Disability, you know what I mean. Sorry.
National Commission on Disability, yes.
I think as a agency with a mandate on policy, maybe they can help to create some sort of a document that can guide parents, because I think it's important that we have a registry of parents or specialists that persons can go to access these kinds of services. And parents can know that when I go, if I'm going to pay for this service, at the end of the process, I have a valid document that I can use.
And it's not just with autism, because
no.
A lot of neurodivergent individuals are being misdiagnosed.
Absolutely.
Because there's the behavioral patterns and the signs and symptoms are very much similar. And if, as you correctly said, you're not qualified or experienced, you definitely can go down the road of misdiagnosis. Dr. Chong, let's expand on or let's deconstruct intervention for children with autism. What does this entail? And who can conduct the intervention?
Kids on the thank you. It's an excellent question, and I guess it's where we see how much of a need there is in Guyana. For persons on the spectrum, they will have deficits in social interaction and communication. That's one area. So for social interaction and communication, we're talking about speech language therapists, pathologists, and being able to give them the services. Understanding in that same thing of social interaction and communication, those who are nonverbal, and providing the support services for them. in AAC devices. Now, AAC devices are very, very expensive. So for me, it would be going the route of PEC, speech exchange communication systems. And this here is basic pictures on a card that a child uses to communicate his or her wants or needs. So when we talk about the intervention, that's one intervention in terms of the communication and interaction part of it.
But before we move on, do we have the speech pathologists and the speech language therapists?
We have
and
speech
so on?
therapists in Guyana. Not enough, I will say, not enough, but we do have speech therapists in Guyana. And I think this is where perhaps we're a bit short on the intervention aspect of it, because kids on the spectrum need consistency in their therapy sessions. They need more therapy sessions than just 30 minutes per week. And then when someone misses that therapy session, then there is a fallback or a regress in their
Yeah,
in
it's
their
all about
progress there.
repetition.
Exactly. So we've got that area there. We've got occupational, in the same social communication and interaction, occupational therapists, and I think in Guyana we've got a good number of them.
Yes.
These are the ones that help with their fine motor skills, because dressing, feeding themselves, the daily living skills, buttoning and unbuttoning a shirt is something that they need. But I must say that while we can talk about the buttoning and the unbuttoning of the shirt, I don't want parents to think that we need to put them in these things here. Huh? What we can do for kids on the spectrum is that we can give them t-shirts. They don't necessarily need to wear a shirt with buttons. Give them a pants with elastic. They don't necessarily need to wear pants with buttons
With
and
buttons,
zippers.
yeah.
Give them shoes that have got Velcro straps or loafers where they just slip their little feet into and they're good to go. But the occupational therapist helps in that regard. There's another intervention. So we got speech and OT, and I think those are two of the major ones so far. Another major one for those who've got behavioral issues would be a behavioral intervention plan that really supports learners. And I said behavioral intervention plan because persons are of the view that ABA is the fit for it all. I am CERTS trained. CERTS is SCERTS, social communication, emotional regulation, transactional support. And within the CERTS model can be found the applied behavior analysis. And that is another intervention you use to work with kids who are having challenges, emotional regulation and transactional support, helping them to understand that if you want to have whatever it is the kid wants to have, you're going to have to do this. And this is where the transactional support comes in, helping them to understand that, to navigate that kind of world there, cause and effect kind of thing there. So a behavioral intervention is important, but on the same thing of behavioral intervention, no child should be on behavioral intervention for the entire life. We need to identify what exactly is the behavior. And we need to put intervention, and that is done via a functional behavioral assessment. Once a functional behavioral assessment is done, we identify what are the antecedents, what happens before the behavior, what is the behavior, and what is the consequence of the behavior. More times than often, what we find, the consequences reinforces the behavior. For example, little Ganesh just doing things for the teacher to send him out of the classroom.
Yeah.
The teachers have the view that if I send him out to the classroom, send him to the head teacher's office, I am helping him by him going to sit out there, and I'm helping the other kids to just be functional in the classroom. But little Ganesh is happy to leave the classroom. So every time you send little Ganesh out of the classroom, you reinforce that behavior there.
And that's because that's his objective,
Absolutely.
to get out of the class. So if I'm getting you clearly, Dr. Chung, the ABA is part of this whole process that includes the speech therapy, occupational therapy, and so on.
Absolutely.
So it's not a standalone.
No, it's not. It all needs to come together. While we have the individual interventions that can take place based on the need of the child, because you may have a kid who doesn't have behavioral issues. They don't have a speech issue because they're high functioning, but they do have the need for daily living skills. So this person just needs an occupational therapist. And then you'll find those who do need the behavioral intervention, and then they start with like I was saying, the functional behavioral assessment. Once we've identified what the behavior is, little Ganesh not sitting, then he's not sitting during the first period, which is the reading period, because he wants to get away from reading. Then we do the behavioral intervention plan, the BIP, and then we put that in place, and then we monitor the progress of little Ganesh over a period of time to see how effective it is. Once we have been able to get little Ganesh to stay seated, then that behavioral intervention is withdrawn, because little Ganesh now understands what is expected of him, and he can continue to function. Until another behavior pops up, then we look to address that specific behavior again.
So it's not a one size fits all, and it's
Absolutely not.
individual.
And this is where the individual education plan comes in, because it gives the teachers, the parents, and the specialists an idea as to, not an idea, an understanding as to what they're doing. So if Kian comes to the diagnostic center here at Turkine, but he's living in Region 2, he takes back the report and the IEP is drafted. The therapists in Region 2 should be able to take that same information and execute the intervention at in their region.
But do we have the capacity to adequately provide intervention, or to provide intervention adequately for children with autism outside of the private sector?
No, we don't.
No,
Excuse
we
me.
don't.
We don't, because it's a number of things that come together to do it, and particularly on the area of behavior intervention. I don't think we've begun to address that issue there yet.
And what more can be done to ensure that it's available?
What is available?
Well, the people to conduct the intervention, especially the behavioral aspect, having the speech therapist and so forth, because I'm assuming that all of this is centralized. So what happens to the children that are in rural Guyana that might have autism?
Oh, well,
Yeah.
I do, well, the diagnostic center goes there and we do the assessment there, and we do the IEPs there.
Now, who implements that
Granted
IP?
that the location is a problem, that's not disputed, and so them accessing, not just for children on the spectrum, for children with any category of disability, accessing some of the services are going to be problematic because they need to travel, and that comes at a cost to get from, let's see, if they're living in Karasabay, to central space where they can access the services, and to get back. I mean, it's a cost to get them to and fro. So, they, in some cases, they don't really access the services as they should be accessing it. So, having more persons trained in all of the areas, and more importantly in the area of behavior interventions, is important.
And I want for the public to get an understanding of the landscape in the Caribbean as it relates to diagnosis and intervention. Because sometimes we're of the view that Guyana is always behind as it relates to disability, as it relates to service provision and so forth. Where do we stand in comparison to other sister countries within the Caribbean?
Well, I can say I sit here then as a proud Guyanese to say that we are right up there. We are right up there. Let's take, for instance, the diagnostic center. In Guyana, as far as I know, is the only place where you can go and find all those specialists, and we offer an interdisciplinary approach to the diagnostic process, absolutely free. In the other sister, brother CARICOM countries, while you go, you'd have to go to different spaces to access the different services, and then you, as the parent, would need to bring those people together to get that kind of services being done.
Which
So-
can be
Sorry?
which can be tedious.
Which most definitely is going to be tedious, because getting those people to organize their time to come together can be problematic. But
but
yes,
it's done under one roof at the
all under one
diagnostic
roof.
center.
Yes. So yes, we do. You can access therapy right there at the center based on where you're coming from and based on your availability. You can access it. So the long and short answer is that Guyana is right there up top. We're championing the cause. We continue to champion the cause. There is need for stronger interagency, interministry collaboration, so that we know what each ministry is doing, where we start, where we end, and the parameters within which we operate are clearly defined for us.
And before we wrap up, Dr. Chung, let's focus on the education system and what is available for children with autism within the special education needs spaces that you have across the country. What is available for those children?
Well, there's the assessment, the screening, assessment or diagnosis, and the
Yeah,
IEP,
yeah.
and a transition plan for the older ones. There's also, we have a curriculum that we use now for them.
Yeah.
This curriculum comes from Jamaica. And I just want to say that when we talk about autism, we can talk about intellectual impairment or intellectual
Yeah,
disability. And so the curriculum fits both categories of disabilities there. We also have now teachers coming out of the Cyril Potter College trained in the area of autism, so they have more information, more knowledge about supporting learners on the spectrum within their classrooms.
So, do you integrate the children with autism in the classrooms with children, other types of disabilities, or do you have specialized classrooms?
Well, now that we have all of this happening, we're moving towards pulling them out. So you have now the Department for Learners with Autism. So they're in their own space for kids with autism. So
Excellent.
teachers can now deliver interventions and best practices against the backdrop of my kiddos are on the spectrum.
Excellent. Dr. Chung, I want to thank you very much for educating the public on what is available and what should be done as it relates to diagnosis. And it's something that I'm very, very passionate about, and that is accurate diagnosis for children with disabilities, whether it's autism or they're they're neurodivergent in some way, and even children with intellectual impairments, blind, and so forth. So I'm happy that you were here to clarify and to share information that parents, especially parents, members of the public, especially parents, can consider before they take that step to get a diagnosis for their children. So thank you very much and continue the good work in the space.
Thank you for having me. Thank you.
That's it for Disability and You. I'll be back next time. In the meantime, do remember disability rights are human rights.